really pleased this year. Attendance has gone up. I think we've just about crossed the 200 mark, and I think that's not necessarily because of the success of the private healthcare. I think that's because of the challenges that the industry faces. We've gone through some difficult times, static or declining health insurance. NHS has kind of pulled the plug on some of the money it was pumping through the private sector, so people are coming to look for the answers.
Today's been a great day, opportunity to network with a number of key individuals within the marketplace, found quite a lot out about satisfaction and about where the market's going from a trend perspective. So yeah, all in all, insightful, great networking opportunity, and I think something we'll be coming back to.
So it's an excellent opportunity for us to meet with people from the private sector. So we're a full range law firm. We advise in a huge range of areas across the private and the NHS sectors. And this is an excellent opportunity for us to meet with providers especially, which is what we're particularly pleased about in terms of the people who are attending today.
It's a very dangerous and hostile world out there at the moment for healthcare providers. There's a lot of risk, and really my message is going to be that prevention is better than cure, which would really put me out of a job. But the best way to protect yourself is to have the right governance, the right management, the right risk prevention strategies in place to reduce the likelihood of a risk, and when something does go wrong, to really make the most of that, to see that as an opportunity and to learn from it.
Well, one of the things that really interested us at the moment, we've got an implementation plan because we're moving facilities from a small facility into brand new facilities. And then one of the themes in our implementation plan was obviously around patients' experience and culture. So for the agenda today seemed to tick all the boxes that we needed.
There has been some recent adverse publicity about safety in the private healthcare sector. Perhaps being deflecting information from the NHS, but actually the main message is about accountability and being able to speak up when things go wrong, and about information sharing and transparency. So I think it was a really good debate that we had today.
I think it's really important to gather together clinicians from different parts of healthcare, whether they be from the NHS or from the private sector. I think this has been a very useful meeting for gathering people together and to start to formulate opinions, particularly around how do we best improve the patient care going forward.
What we're saying and here to do is to open the minds, the eyes, the ears of the businesses to say, look, don't be afraid of this feedback. It's there anyway, more and more, and you can see it now. And it's not about putting your heads in the sand. It's about harnessing it. It's about asking for feedback and allowing it to materialise and in fact drive your patients, your consumers towards sites like Google, like Facebook, where it's going to give future patients, future customers the opportunity to read and understand the care that they've had when they've come and met with a physician, a consultant, or just a facility in general.
The key take home for me is that when people think about growing the self-pay business, it's not a strategic concern, it's more a cultural change piece. It's about cultural change management, because in healthcare we've never been very good, because we've never had to address the customer, and it's about bringing the customer into the room and making sure that we respond to the needs and the needs and the wants, if you like, of that customer. And so until you can go through that cultural change, your strategy will always fall by the wayside because it won't get embedded or implemented.
Brexit funding of the NHS, frankly nothing new. We've known about this. The amount isn't particularly significant, and if you deduct some of the on costs that are being built into NHS health costs, backlog maintenance, pensions push. Actually, there's not much in it. I think the impact for all of us at Brexit is going to be much more about workforce.
My overarching aim really is to get more and more people working together. So the private health groups, the clinics, the doctor, I think we all need to be a bit more unified in how we look at London as a health tourist hub and how we work together and share information and move forward. I think we've got an enormous opportunity to increase the number of health tourists coming here, and I think the way forward is by doing that collaboratively.